Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone. First of all, let me introduce myself. My name is Dhea Oktaviany Putri, NIM E31170 from Demographic and Civil Registration, University of 11. Now I want to presentation with title is COVID-19 in Indonesia. Well, the COVID-19 is a virus that spreads through droplet produced when someone coughs, sneezes, or breathes. The droplet then stick to the floor, clothes, hand, and others. Someone will be infected if they breathe in air that contain virus and observe the surface of contaminated object. So the government requires everyone to apply social distancing. The symptoms are most common when a person is infected with fever and dry cough. But there are also different symptoms such as discomfort, sore throat, diarrhea, headache, rash on the skin, and etc. In Indonesia, COVID-19 pandemic has been running for more than 9 months. But till now, there is no clear point of this transmission. It can be seen from the increasing number of cases of patients who have tested positive for COVID-19. From data obtained from the COVID-19 task force, the total number of cases has increased to 617,820 people since the first case were announced on 2nd of March 2020. In a day, there were an additional 4,460 patients who recovered based on laboratory tests using the polymerase chain reaction method, whose results were negative for the coronavirus. So, the total number of COVID-19 patients who have recovered has reached 505,836 people since the beginning of the pandemic, although this cannot cover the fact that there are still many additional positive COVID-19 patients who have died. In fact, around 166 COVID-19 patients on 12 till 13 December 2020. Currently, there are also 165 active cases on COVID-19 in Indonesia. These active cases are patients who still positive for the coronavirus who are undergoing treatment in hospital or independent isolation in their respective home. Then the government also announced that there were around 63,598 people with the suspicion status. In detail, there were 510 districts or cities from 34 provinces that recorded the transmission of the coronavirus. This means that the COVID-19 pandemic has been affected in more than 99% of Indonesian territory. This is the diagram of COVID-19 in Indonesia that I got from the website of the COVID Security Task Force on 15 December 2020. Now we can look at the table. The policy carried out by the government during the pandemic was in the form of distributing basic foodstuff to people in need. This is due to the large number of work contract termination of many factories or companies by COVID-19 on employees, so that many residents lost their job to meet their daily needs. Namely, the government has stated that the policy is mandatory for people who have activities in the outside. The program is known as 3M, who wears a mask, realizing is and maintaining a distance to avoid COVID-19. The beginning of the spread of COVID-19 in Indonesia meant the government have to implement large-scale social restriction in certain areas such as Jakarta and its surrounding. However, it's only a few months, considering that many people need to work in the field to provide their families. Next, there is the social safety net. The government has allocated a budget of 110 trillion of this post. Lastly is economic survivability. The main focus of the government in maintaining Indonesia's economic survivability is to assist the UMKM group, which has been the pillar of Indonesian economy. Then Abidin Fikru said that the government has increased the health budget from 57 trillion rupees to 76 trillion rupees to help people directly affected by COVID-19 to get relief from medical expense. He also said that the government, even though it is limited, remain alert in dealing with COVID-19. So it is hoped that this will reduce the number of COVID-19 virus transmission in Indonesia. And that is my presentation. Thank you for your attention and have a nice day.